The mental health crisis card is a valuable tool for me at the very least because I go nonverbal whenever I get extremely anxious or stressed. And in an anxious or stressful situation, like something that's high stakes, something that would be like contact with police or contact with first responders or contact with emergency room personnel, that would be when I would use it. And why I would use it is because it has all of my information and it has all of my diagnoses or symptoms or answers to questions that I might not be able to answer verbally at that time, to be able to give to someone and say, "This is what I need from you. Can you help me?" My story, when I was 17, um, I had a polynatal cyst, which is a cyst on your tailbone. So if your tailbone is here, the cyst was right here. It was just underneath it. And it was pressing on my spinal cord. And it was about the size of a softball. And when I went in, I was in probably the worst pain that I've ever been in my life. I couldn't feel my feet. And it was a very anxiety-inducing and stressful situation, coupled with the fact that I had a diagnosed phobia of hospitals at the time. So needing to go in was terrifying to me. I went in and I tried my best to advocate for myself, and my mom tried her best to advocate for me. I said to the ER doctor who was evaluating me, "Hey, I have an autism spectrum disorder, I have generalized anxiety disorder, and I have a phobia of hospitals. I need you to not tell me what's going on, and I need you to not show me any of the medical instruments." And he rolled his eyes at me and said, "It's called informed consent. We have to get through this." And so he told me exactly what he was going to do. And when he brought in the instruments, he put the table right in front of me. Because I was laying on my stomach because the sister's on my back. He put the table right in front of my face, and said, "This is how I set up my workstation," when I asked him to move it. Um, and then when I went into a full out panic attack and needed to be restrained, um, my mom was actually the one who restrained me. Nurses attempted to assist, but were not trained and did not know what they were doing. Um, my mom put me into a primary restraint technique from Handle with Care, and held me like that for about 30 minutes while I kicked, screamed, headbutted, tried to struggle out. At one point, I kicked the doctor who had the lidocaine needle because he was trying to inject me while I was having a panic attack. And it almost hit him in the eye, which honestly would have been natural consequences. Um, but he, after 30 minutes, said, "I am not comfortable proceeding any further today." Um, and my mom kind of said, like, "Yeah, you think?" Um, and so we were able to leave against medical advice, and go to a specialist the next morning, to drain that cyst. But it, at the time, was horrendous because it was, again, the worst pain I've ever been in. It was pressing on my spinal cord. It could have gone septic at any minute. Um, it was, I was lucky that I didn't die or become paralyzed, because that doctor did not listen to my mental health needs in order to help me with my physical ailment. If especially adults in the professional field were to listen to young adult and youth voices for what they need and believe them for what they need and what they are asking for and advocating for, I think that that would change how we look at bodily autonomy for persons under 18. I think that would change how we look at um, issues of consent. Um, and I think it would change how we handle mental health crises. We would no longer be escorting suicidal people in handcuffs to hospitals. We would no longer be triggering people with phobias and rolling their eyes at us um, and assuming that they know better. Um, I think it's important to realize that the only person who knows your mental health struggles and your personal needs is you. And so the card is sort of an official statement of this is what I need, this is how I need it to happen, from your voice and your perspective. When to use the card is not when you are already in crisis. When you are already in crisis, if you are too far gone, you're not going to be thinking about the card. You're not going to be thinking about how these people are going to help you. You're going to be in fight or flight or freeze or fawn or any of the Fs. And to you are already having a traumatic experience. The point of the card is to head off that traumatic experience before we get to here. So, at my day job, we have a program that we use called the Incredible 5 Point Scale. The Incredible 5 Point Scale is a scale from 1 to 5, where one is where you are at your calmest and you're cool, collected, you're reading a book, you're meditating, you're sleeping, maybe you just woke up for the day. Maybe you're having a relaxing Saturday. That's your 1. And your 5 is fight, flight, freeze, fawn, flock, faint, all the Fs, where your amygdala is kicked in and your frontal cortex is not working at all. So you want at the 3, 3, 4, 2 in there, um, is when you are starting to get anxious or you are starting to get upset or you're starting to get angry and you can feel yourself reaching that tipping point. That is where you use the card. You ask for help before you get to here so that we can talk about it or get you what you need so that you can talk about it um at a later date or at a later time when you come back down to your 1 or your 2. Um and you can just kind of, again, head off, like turn off the heat before the water boils over.